Hello everyone, welcome to my YouTube channel Pharma Researcher. So this is the video number 13 of Telangana Pharmacist Grade-II exam preparation. So the exam is going to be held on the 30th of November 2024 and this is the series on our YouTube channel Pharma Researcher, in which we are discussing a total of 10 units that are mentioned in the syllabus. So we are discussing each unit as per the syllabus, as per the subtopics mentioned in the syllabus. And in this particular series, we have already covered the initial 6 units of different subjects, different MCQs we have solved. And if you haven't watched those videos yet, so you can watch those videos. I have provided the link of each and every part of the video in the description box. You can simply check the description box, click on the link with the video number, and you can watch the other videos as well. Talking about this particular video, so in this video we are starting the unit number 7. So in this unit number 7 there are different subtopics, and today I am going to cover the first important topic, that is regarding the hospital pharmacy. So this will be the part number 1 video for unit number 7, and tomorrow we will be covering the unit number 7 complete. So regarding the PDF of this particular video, so I have provided the link of two PDFs. One is with answers, the other one is without answer. So for practice, the MCQ questions after this particular video, you can prefer any of the PDF, and for revision you can choose the answered PDF. So let's start first with the discussion of the subtopics which are mentioned in this particular unit. So this is the unit number 1, part number 1. So in unit number 7, there are different subtopics. For example, organization, management, function of hospitals. So till this pharmacopoeial test. So this topic is of hospital pharmacy. This topic is of hospital pharmacy. Then disease manifestations, pathology of tuberculosis, hepatitis, these different drugs, adverse drug reaction, antidotes, different symptoms and treatments of different types of poisoning, drug dependencies. So these topics are of different subjects. Like you will see these subtopics in different subjects like toxicology. In hospital pharmacy also you will study these adverse drug reaction, the poisoning related data. So this particular section I will be covering in the next video. In this particular video I will be only covering this particular hospital pharmacy related things. So let's start with the first question, or first we can discuss like which subtopics are in this particular first section. So organization, management and function of hospital, hospital pharmacy, location, layout, flow chart of materials and men. So flowcharts are quite easy. I haven't included in this because this very simple procedure you all must have gone to the hospitals as inpatient also and as an outpatient. Generally, people goes to the hospital as an outpatient, like they simply go to the doctor, they simply take a prescription, that is a form filling procedure, then they will go to the doctor, and if he diagnoses you something, he advises you to do some test, or he said like everything is fine, there is nothing to worry, so you can simply go back to your home. So that is the general flow of outpatient. Inpatient, like if doctor sees like there can be a serious condition, so he will admit that patient, and then further process will be going on in the hospital only. So this is the basic flow chart of materials. You can simply, if you can simply google the flow chart of materials and men, you will get different flow charts in the images section. So that is quite easy. So hardly from this particular topic the question will come, but if question will come, so that will be related to the flow, like the order of the movement of materials or men in inpatient, in outpatient. So by reading the question and option itself, so you will be easily able to find out the answers. Then there are several drug distribution systems in hospitals for outpatient and inpatients. Then pharmacy therapeutic committee, hospital formulary system and their organization, functioning, composition, then drug information services and drug information bulletin, and several surgical dressings according to their pharmacopoeial tests. So these are the different subtopics that will be included in this particular video. So let's start with the first question. So the question is, which type of hospital provide day-to-day healthcare facilities? So basically, hospitals have been classified in number of ways. So in general, there can be three main types of hospitals. That is primary hospitals, secondary hospitals, or tertiary hospitals. So basically, in primary hospitals, uh, there are services that are provided day to day for healthcare facilities. So these are the services of day to day healthcare facilities. So here option A will be the correct answer. Then if I'll talk about the secondary hospitals, so secondary hospitals are a type of hospital providers. In this type of hospital providers, the first level of recommendation services. These are the first level of recommended services which are more complicated and beyond the scope and capacity of the hospital of the primary level. Like if a patient is not well treated in the primary hospital, he need some higher supervision or higher testing, higher thing that is not provided in the primary hospital, he will go to the secondary hospital. Then there are tertiary level hospitals. So tertiary level hospitals, these are such a level of hospitals that deals to provide highly specialized care services at a regional and central level. At regional and central level hospitals, for example, there can be several teaching hospitals in which the like MBBS hospitals, various hospitals where teaching is also there, and side by side the hospital is running. For example, several cancer hospitals, there are several super specialized hospitals, mental disease hospitals. So these all types of hospitals comes under tertiary hospitals. Then moving to next question. So the question is, which of the following hospital is not classified based on anatomical physiological specialization? So here the orthopedic hospitals, eye hospitals, kidney hospitals. These three are based on anatomical and physiological specialization. Okay. But pediatric hospital, these are not classified based on anatomical physiological specialization. Rather, they are classified based on the client group they serve. Client group they serve means pediatric means basically children related. If I'll talk about the other hospitals that are based on client group, so these can be the gynecological hospitals for women. Okay, gynecological hospitals. Then there can be maternity hospitals for mothers. So these are the different types of hospitals based on client group they serve. And apart from orthopedic hospital, eye hospital, kidney hospital, there can be ear nose hospitals like ENT, skin care hospitals. So these kind of hospitals comes under anatomical and physiological specialization. Next, moving to the another question. So the question is, which of the following type of hospital is classified based on medicine? So based on medicine, there can be several type of hospitals. For example, allopathic hospitals, Ayurvedic hospitals, homeopathic hospitals, Unani hospitals. There can be nature cure centers. There can be physiotherapy centers. There can be physiotherapy centers. So these are the different hospitals based on the system of medicine. So here option D will be the correct answer. Then moving to the next question. So the question is, based on size, large hospitals are. So based on size, large hospitals can be the ones in which beds are around 1,000 or above. So here option D will be the correct answer. So based on sizes, I have seen multiple PDFs, multiple slideshare documents, multiple books. So based on size, there is very different data given in different books. So somewhere it is given like around five more than 500 beds are large hospitals. Somewhere it is given three more than 300. So the answer for these based on sizes hospitals you can choose based on the options given as per the question. So the data which I have added in this question are basically these are very small size hospitals comes under with beds less than 100. If beds are between 100 to 500, these are the small hospitals. If beds are between 500 to 1000, these are the medium size hospitals, and beds are 1000 or above, these are the large hospitals. So based on options you can choose, or you can also visit some other books from where you will get some different data. So this question you can always confirm with different books. Now moving to the another question. So the question is, which of the following is the objective of hospital pharmacy? So the objective of hospital pharmacy, it includes to ensure the availability of right medication at right time in right dose at minimum possible cost. Like the drug should be the right medication means there can be right dose. Right medication means correct medication. If a person is required antiemetic drug, then he should be given antiemetic only, not the antidiarrheal. So that is right medication at right time. If there is any emergency, so the drug should be given at the right time. It should not be delay. It should be given in right dose means that prescribed dose which is given for the general population, that should be there. And minimum possible cost, it should not be like that if a person is having emergency so you can charge more money. So it should be minimum possible cost. Then to professionalize the functioning of pharmaceutical services in a hospital. So in hospital, if pharmaceutical services has to be professionalized, then also this is the objective of hospital pharmacy. And to participate in research projects, so this is also the objective of hospital pharmacy. Apart from this, to act as data bank, on drug utilization, to implement decisions of pharmacy and therapeutic committee. It is the objective of hospital pharmacy. So this point is very important, like to implement the pharmacy and therapeutic committee decisions of PTC. Who is responsible for that is the hospital pharmacy. And also to act as a counseling department. Counseling is also provided for medical staff, nurses, patients. So this different objectives are there for hospital pharmacy. So here the correct answer will be option number D, all of the above. Next question is, which of the following system is used for drug distribution in hospital? So in hospital, in order to drug distribution, the different systems are used. For example, individual prescription order system, complete flow stock system, unit dose system, and also there is a combination of individual prescription order system and flow stock system that can be used. So here option D will be the correct answer. Like these are the different systems that are used for drug distribution in hospitals. So here option D will be the correct answer. Next question is, a type of drug distribution system wherein physician writes the prescription for individual patient who obtains the drugs prescribed from any medical store or hospital dispensary by paying on charges is. So basically the drug distribution system is that, like, a patient goes to the physician, he writes a prescription, he mentioned the drugs which are to be taken. Then the individual takes that prescription. He will go to any medical store, nearby medical store, or in the hospital dispensary, like in the OPD where the medicines are prescribed in the hospital. And then he will pay for that medicine, and then he will leave. So this type of drug distribution system is known as individual prescription order system. So here option A will be the correct answer. Then next question is, in which floor stock system type there is no direct charge from the patient account? So basically what happens in floor stock system, there are two types. It can be charged floor stock system or it can be non-charged floor stock system. So in charged stock system, what happens? So in this particular method, medicines which are stocked in the nursing station. Okay, so basically in a flow stock system, the medicines are stocked in nursing station area. So in charge flow stock system, medicines which are stocked in the nursing station, all the times in charge to the patient, they will charge to the patient when the medication is given to that patient. So when there is a stock in the nursing station, whenever nurses will give this medicine to a patient, then after medication he needs to pay the amount that the medication has been prescribed. So the patient is charged for every single dose administered to him. So this is the main thing in the charge flow stock system. Then in the non-charge flow stock system, what happens? So this system basically includes the medicaments which are placed in the nursing station. They are given to the uh, patients on the floor. These are used by the patients on the floor, and there is no direct charge. There is no direct charge from the patient's account. So here the question is, in which flow stock system type there is no direct charge from the patient account? So it is the non-charge flow stock system. So here option B will be the correct answer. Next question is, in unit dose system, CUDD stands for. So in unit dose system in which the single dose is being given, so there are two main types like the CUDD and DCUDD. So CUDD stands for Centralized Unit Dose Drug Distribution System, while the DCUDD stands for Decentralized Unit Dose Drug Distribution System. So here option A will be the correct answer. Next question is, label that the pharmacist attaches to the prescription medicine is. So when the pharmacist attaches a label to a prescription medicine, so that label is known as, so this label is known as dispensing label. So here option B will be the correct answer. And this dispensing label includes the drug name. It includes the drug name and the quantity, the patient's name. It includes the prescription number. It includes the phone number. It also includes the instructions for use, and it also includes the pharmacy name and address. So these are the different informations given in the dispensing label. Then there is another label, that is the manufacturing label. So manufacturing label is a label which contain drug information for the use of medical practitioner, pharmacist or nurses, which are supplied by the manufacturer paper or drug distribution of the drug. So basically this includes the drug manufacturing things, like if you can see the label behind the any strips of tablet or capsules, so there you will find the different information regarding the manufacturing. So those all information are given in the manufacturing label. Next, moving to the another question is, ambulatory patients include. So basically the ambulatory patients are those patients who are not admitted in the hospitals. So they basically go to the hospital, take the necessary uh, advice of the doctor, take the necessary medication if required, or emergency treatment, necessary treatment. So after doing that, they can leave the hospital. Or in simple terms, these are those patients who do not occupy beds in hospitals. So those are the ambulatory patients. So ambulatory patients are basically the outpatient, you can say. Like outpatient are also those which do not take bed in the hospitals. They simply go take the uh, advice or treatment of the doctor, and then they can leave to their home. So all the emergency outpatients, referred outpatients, special outpatients. So every type of outpatients comes under the type of ambulatory patient. So here option D will be the correct answer. So this ambulatory patient is also very important. Many times the question has been seen from for this particular definition. Now moving to the another question. So the question is, the drugs which have high potential for abuse and have no accepted medical use in the treatment comes under which schedule for controlled substances? So the drugs which is having high potential means they have the high potential, high power of producing the abusive conditions in a patient, and there is no medicinal use in the treatment of these type of drugs. So these comes under which schedule for the controlled substances? So for controlled substances, these comes under schedule number 1. So here option A will be the correct answer. So here if I'll talk about the examples, so there can be marijuana or raw opium. So these different drugs are the high potential drugs for abusing. Then if I'll talk about the schedule 2, so in this schedule 2, the drugs under this schedule, they have the less as compared to the schedule 1 drugs, like they have less potential for abuse, and they can have the accepted medical treatment and have a lesser physical dependence or physiological dependence. For example, different benzodiazepines can be used. There can be phenobarbital, codeine. Codeine is antitussive. There are different steroids, different painkillers. These comes under schedule number 2. Then if I'll talk about schedule number 3, so in schedule number 3, the drugs under this schedule, they have less as compared to the other potential, like which I mentioned in schedule 1 or 2. They also have the less potential for abuse, and they also accepted for the medical treatment. So in this, there are similar kind of things like the low strength phenobarbital, benzodiazepines, codeine. So these similar type of drugs comes under schedule 3 only. Then moving to the next question. So the question is, which of the following is involved in the preparation of hospital drug formulary? So under hospital drug formulary preparation, different members are involved. So these member can be a representative clinician from each major specialty. So for every major specialty, there can be a representative clinician. Then there should be a clinical pharmacologist. Then there should be a member of hospital records department. Then there is also a nurse. Usually the senior infection control nurse, or sometimes the matron. Then the member can be a pharmacist. Which is usually the chief pharmacist or deputy chief pharmacist. Okay, so the member involved in the preparation of hospital drug formulary among pharmacists should be chief pharmacist or deputy chief pharmacist. Then there can be a clinical microbiologist. Then there can be an administrator who is representing the hospital administration and finance department. So these different members are involved in the preparation of hospital drug formulary. So here all these members are included. So here option D, all of the above will be the correct answer. Next question is, the primary objective of the formulary is to provide the hospital staff with. So basically the primary objective of hospital pharmacy is to provide the hospital staff with information of the drug products approved by the PTC, that is Pharmacy and Therapeutic Committee. to provide the information of hospital policies and procedures governing the use of drugs, like how we can use the drug. Then special information regarding drugs, there can be special information regarding the drugs that also need to be provided to the hospital staff. So these are the different primary objectives of hospital formulary. So here option D, all of the above will be the correct answer. So basically the main objective of formulary is not only to control the use, it is not only to control the use uh, of the drug, but also to supply the useful information to the prescribers, such as these information that I have mentioned, like information of drug products, information of hospital policies, special information regarding the drug. So these also is the objective of hospital formulary. Then moving to next question. So the question is, which of the following is the main section of hospital formulary? So basically, the hospital formulary has three main sections. It has three main sections. The first one is regarding the information on hospital policies and procedures concerning drugs. Then there another section is drug products listing. What are the different products that are in the hospital? Then there can be special information regarding different policies, different drugs, and other information. So these are the main three sections of hospital formulary. So here option D, all of the above will be the correct answer. Next question is, full form of PTC is, so this we are discussing PTC, so this is the Pharmacy and Therapeutic Committee. So this is given in the option number B. So full form of PTC is Pharmacy and Therapeutic Committee. So option B is correct. So basically PTC is an advisory group. It is an advisory group. So this particular term you need to remember, like PTC is a advisory body, so it is a advisory group of medical staff. It is a advisory group of medical staff, and it serves as the organizational line. Of communication between whom? Between medical staff and the pharmacy department. Okay, between medical staff and pharmacy department. Who is the organizational line? So that is the PTC. Okay, so these different points you need to remember in the definition of PTC. Now moving to another question. So the question is, main objectives of PTC include. So the main objectives of Pharmacy and Therapeutic Committee, it includes advisory, educational, drug safety, and adverse drug monitoring. These are the three main objectives of PTC. So here option D, all of the above will be the correct answer. The next question is, pharmacist serves as dash in PTC. So pharmacist, basically, if I'll talk about the composition of PTC, so under composition there can be a physician, there can be a pharmacist, there can be nursing staff, so the physician is the chairman in PTC. Pharmacists serve as a secretary. Pharmacists hold the post of secretary, and the nursing staff hold the post of representative joint secretary. Okay, so this is the basic composition of PTC, like who serves what. So as this is the pharmacist exam, so mostly the question will be asked for pharmacist only. So here you can remember, like pharmacist serve as a secretary. So here option B is correct. And other you also need to know, like who is what. Next question is, DIC stands for. What is DIC? So DIC is Drug Information Center. So here option A will be the correct answer. So it is a center where you will find the information regarding the different drugs, complete information regarding the drugs. Then moving to the next question. So the question is, PHCs stands for. So PHC stands for Primary Health Centers. So here option C will be the correct answer. Next question is, which of the following is the function of DIC? So Drug Information Center, DIC is Drug Information Center. And what are the functions of DIC? So the function of DIC is to provide the information on all aspects of therapeutic use of drugs. Its function is to provide the information on dose, administration of drug. Basically, the each and every information of the drug should be there with the drug information center. If any information is asked from there, so they should be able to provide this particular information. Then they should provide information on adverse effects of drugs. Then they should provide the information on the indications and safety indication of drugs. They should give information regarding the drugs in pregnancy and lactation. They should provide the continuous educational programs for providing the rational use of medicines or rational use of drugs. So drug information can be related to academic and research. So different information regarding the drug, whatever information is regarding the drug, so that is the providing that particular information comes under the functions of drug information center. So here the correct answer will be option number D, all of the above. Next question is, which of the following include primary source of information? So the primary source of information will be the original articles. So here option A will be the correct answer. So there can be three main different categories of sources, like the primary sources, the secondary sources, and the tertiary sources. If I'll talk about the primary sources, so primary sources basically provide the up-to-date information. They provide the up-to-date information on a particular topic. So they include the unpublished studies. They include the original articles that are published in original articles that are published in reputed reputed journals. If you find any articles like online, various research articles, review articles are available. So if you can see those articles, so those are the original articles, and sometimes some are trial based studies which are undergoing. So those are the unpublished studies. So these different information comes under the primary sources. Then if I'll talk about the secondary sources, so under secondary sources, basically the abstracts comes under the secondary sources, abstract or indexes which summarizes the information, because abstracts have the summary of information. If you have seen any research article or a review article, so in the starting there will be a section of abstract in which the complete summary of the whole article is given. So those summary information, the citations, data, so these all comes under the secondary sources. For example, they can be telegraphic abstracts in which only string of words are given. They can be indicative abstract in which the structure which is structured in form of sentences. They can be informative abstract which is simply a summary part. So these are the secondary sources of information. Then there are tertiary sources. So tertiary sources are the basically information that is contained is well established. It is a well established and easily accessible information, and it is preceded by the primary literature. So basically it do not provide the updated information. So in this basically the reference books are there, like for example, if topic in a particular book, like the drugs are currently in use. So if I am having a book of 2018 edition, okay, so in that book there is no updated information. Okay, so there will be the information that was available till 2018. What I'm reading that book in 2024, so maybe there is some information that is not updated regarding these 6 years. So in order to that, so those are the previous information, or we can say these are not the updated information. provided through the tertiary sources. In this tertiary sources, there can be different pharmacopoeias, reference books, drug compendias, national list, WHO treatment guidelines, drug formularies, drug bulletins. So these are different tertiary sources. Now moving to the next question. So the question is, Sinahal is the secondary source database which focuses on, so Sinahal, it is, the full form is cumulative 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 index to nursing, cumulative index to nursing and allied health. So if you know the full form, so you will be able to identify, like, Sinahal basically focus on what parameters. So it focuses on the nursing and allied health literature. So here option is B correct. Basically based on full form only you will be able to find out the answer. Now moving to the next question. The question is, the attending physician should report to the dash about each case of adverse reaction. So the attending, whosoever is the attending physician, so he should report to the chairman of pharmacy and therapeutic committee. And who is the chairman of pharmacy and therapeutic committee? So the chairman is the physician. Among one of the physician is the chairman, and whosoever is the attending physician, he should report to the main chairman physician, who is the member of PTC. Then moving to the next question. So the question is, which of the following is not the part of secondary source citation? So we need to identify, like, which of the following is not the part of secondary source citation. So here if we can see PubMed, ToxLine, Medline. So these basically, if you have gone through these databases, so these basically provide the abstract related information. So whenever you will find any study, this particular database will provide you the title, abstracts, and different several citation information. So here pharmacotherapy, it is not a part of secondary source citations. Rest, PubMed, ToxLine, Medline, these are the secondary source citations. Next question is, dash is a vast collection of information about numerous drugs such as physician's desk reference. So this particular include compendia. So these are having vast collection of information about numerous drugs such as physician desk reference as well. So here option A will be the correct answer. Next question is, number of pharmacists required for hospital up to 200 beds. Very important, or we can say most important question in this particular topic. So the number of pharmacists required for as per the different bed strength are very important. So here it is asked regarding up to 200 beds. So up to 200 beds, 8 pharmacists are required. So here option B is correct. Now based on different bed strength, there are different number of pharmacists required. So if I'll talk about up to 50 beds, number of pharmacists required is 3. Then if number of beds will increase up to 100 beds, so up to 100 beds, the number of pharmacists required is 5. Then up to 200 beds, number of pharmacists required is 8. Up to 300 beds, number of pharmacists required is 10. And up to 500 beds, pharmacists required is 15. So these all the numbers are very important. Many a times the question has been asked from this particular topic, so it becomes very important question. Now we can move to another question. The question is, in hospitals, the pharmacy should be located on. So basically in hospitals, the pharmacy should be easily accessible. Should be located on the easily accessible for all category of patients. So it should be located on the ground floor, or either it can be located on the first floor, but mostly the ground floor is the preferred one. So here option B is correct. Next question is, which of the following statement is not correct regarding ideal dressing properties? So for ideal dressing properties, we need to identify the incorrect statement. The first is should absorb water vapor. So this is correct, and the dressing should absorb water vapors. It should absorb excessive secretion if at the particular bound there is excessive secretion, so it should absorb the excessive secretions. It should adhere to the granulating surface, so it should not adhere to the granulating surfaces. Then it should be resistant to microorganism. This is also true. So the non-ideal condition is option number C. So option C is the correct answer. Next question is, in the USP, dash cotton is official as purified cotton. So as per the USP, the surgical cotton is official as purified cotton. So option A is correct. Next question is, absorbent cotton wool is derived from the seed coat of various species of dash genus. So the absorbent cotton wool, it is derived from the Gossypium species. So here Gossypium genus. So here option C will be the correct answer. Next question is, on treating the cotton fibers with iodinated zinc chloride solution, they turn. So this is the test for cotton fibers. So when the cotton fiber is treated with iodinated zinc chloride solution, they will turn to violet color. So here option D will be the correct answer. Next question is, dash is an absorbent material having enough strength to serve as surgical dressing. So the absorbent material which is having enough strength to absorb or to serve as surgical dressing is gauze. So here option B is correct. Next question is, absorbent cotton wool should contain less than dash concentration of sulfated ash. So the absorbent cotton wool, it should have less than 0.5% concentration of the sulfated ash. So here option A is correct. Next question is, dash gauze is a non-medicated soft cloth of plain weave, open texture and delicate appearance. So it is a absorbent gauze which is a non-medicated one. It is having soft cloth of plain weave, open texture and dedicated appearance. So these are the different properties of absorbent gauze. So here option A is correct. Next question is, dash has a closer and finer texture and is made up of cotton, rayon or broth. So this one is the absorbent ribbon gauze. So absorbent ribbon gauze has a closer and finer texture and it is made up of cotton, rayon and or both cotton and rayon. So here option D is correct. Next question is, dash bandage is used for head dressings, binders, arm slings and temporary splints for broken bone. So this type of bandages are known as triangular calico bandages. So these are basically used for head dressings or binders, arm slings or temporary slings for broken bone. If the bone is broken, then this triangular calico bandages are used. So here option C is correct. If I'll talk about domet, so domet is a soft and flannel-like fiber. It is flannel like fiber and it is typically made of from cotton or cotton blend. It is made from cotton or cotton blend and it has a textured surface and it is generally used for comfort and warmth. For comfort and warmth it is used. Then if I'll talk about the cambric, so cambric is a lightweight. It is lightweighted. It is tightly woven fabric. It is tightly woven fabric, and it is made from either cotton or linen. And also it has smooth surfaces and it is sometimes used for dressings or as a cover for wound care. So this is the use of cambric. Then if I'll talk about the open wove, so open wove is refers to those materials which are having loose or open weave, open weave that allows circulation. Basically, they have the open weave so that there will be a proper circulation of air. So these type of bandages are often made from, either they are made from gauze or they are made from other breathable fabrics. Now moving to the next question. So the question is, dash is well known elastic bandage with zero rubber content. So the elastic bandage with zero rubber content is crepe bandage. So here option A will be the correct answer. Next question is, dash bandage is made up of cotton cloth of lino weave and impregnated with dried calcium sulfate and adhesives. So these type of bandages are plaster of Paris. So here option D is the correct answer. So these are made up of cotton cloth of lino weave and they are impregnated with dried calcium sulfate and adhesive. These all the information you need to remember because the question can be transformed in another way also. Then moving to the next question. The question is, adhesive tapes are used as a surgical dressings in condition when skin trauma has to be minimized. So in order to minimize the skin trauma type conditions, so the surgical dressings are used, and these are the acrylate adhesive tapes that are used as surgical dressings. And basically acrylate, these are the tapes. These are very gentle on skin, these are very gentle on skin, and still they offering a strong adhesion, they still offering a strong adhesion, uh, irrespective of the gentle to the skin, and they become very ideal for sensitive skin areas. Now moving to the next question. The question is, dash are sterilized, pyrogen free, disposable, and are used for delivering fluid or intravenous route. So these are the intravenous sets, IV sets. These are the sterilized. These are the different properties, like they are sterilized, they are pyrogen free, they are disposable also, and they are used for delivering the fluid by the intravenous route. By the name itself, it is clear, like they are made for the intravenous route. Moving to next question. The question is, dash catheter remains in the urethra for longer period of time. So which type of catheters are used and they remain in the urethra for a large period of time or longer period of time? So these type of urethras are Foley catheter, sorry, not urethra, the catheter. So here option A is correct. Next question is, dash catheters are available separately for males and females. So these are the types of metallic catheters which are available for males as well as and for females, both separately. So here option B is correct. Next question is, dash tip of syringe is used when needle is to be kept parallel to the injection field. So the tip is eccentric tip of syringe is used when the needle is to be kept parallel to the injection field. This is the injection field, and so it should be kept parallelly. Then moving to the next question. The question is, dash tip is used for irrigation and not for injection. So for irrigation purposes, catheter tape is used. So here option D is correct. If you want to see the images, so you can simply search these terms and you can simply search on the Google, you will find the images like how it looks like. Next question is, in dash syringe, the glass plunger is ground to fit the barrel. So in reusable syringes, these are the type of reusable syringes in which a glass plunger is grounded to fit the barrel part. So here option B is correct. Next question is, Carrie Skinner in 1896 invented. So he invented the glass syringes in 1896. So here option A is correct. Next question is, which are available in capacities of 1 ml and even 0.05 ml volume can be accurately measured. So these are the disposable syringes. These disposable syringes are made in very low capacities like 1 ml and even 0.05 ml volume. So here option C is correct. The next question is loss on drying in absorbent cotton wool should be less than dash concentration. So the loss on drying in absorbent cotton wool, it should be less than 8% concentration. So here option B is correct. And with this particular question, we are done with this particular topic. So this particular topic is completed. Rest all the topics like the disease manifestation part, adverse drug reactions, the poisoning related poisoning, antidotes, drug dependence, these are quite smaller topics, and I will be covering these topics tomorrow. So that's all for this particular video. This is quite easy and theoretical type of questions will be coming from this unit. So yeah, that's all for this video. Let's meet in the next video. Till then, thank you very much.